Related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home healthcare agency servicing Palm Beach County, Broward, and Miami-Dade. Our phone number is 954-717-7027. I am your host, Louise Gomez, and I would like to welcome to the show. Today we have Dr. Bilga Attar, and she is right here in Boca Raton at the Legacy at Boca Raton, 6363 Verde Trail South, Boca Raton, Florida, 33433. The phone number there is 561-483-9282. You can also email her at bilgaattar@aol.com. Welcome to the show. Welcome back.
Thank you. It's nice to be back on the show.
We're so happy to have you. And I know you're at the Legacy. I believe they were rated recently best short-term care facility by U.S. News.
That's right. That's right. Mm-hmm.
Oh, that's exciting.
It is. It's a wonderful facility. Now the hospitals are trying to facilitate discharges sooner.
Okay.
So these patients would get more rehab and taken care of at this facility, which is an excellent facility. We call that subacute. Still, now in the old days, these patients would have been in the hospital.
Okay.
Yeah, and
so we do their rehab.
Oh, they have their rehab, and we take care of the medical problems.
Okay.
And we have a physical therapy doctor, Dr. Grobert.
Oh.
He's wonderful. And I have 2 nurse practitioners helping me out. So we take care of the patients, and hopefully they get better and they go home.
Nice.
Mm-hmm. And we send them back to their own doctors.
Right. And so what hospitals is it affiliated with?
It's they're with, actually we get patients from all over,
Okay.
mostly from Boca Raton Regional Hospital.
Right.
And then we get quite a bit from West Boca Medical Center and Delray Medical Center. Mm-hmm.
What's the average time that a patient would stay at the facility? I know it depends. Everyone's different.
Oh, it depends. It depends on their illnesses, how chronicity of their disease, and their ability to perform activities of daily living, which we call the simple stuff like showering, having to use the bathroom on their own. That's the first thing.
Right.
Is being able to get out of bed,
Yeah.
hopefully unassisted or with minimal assistance, and be able to walk to the toilet, take care of themselves, and go to the kitchen to have their meal.
Right.
So that would be the minimal requirement. This is what I tell my patients, most of them.
And so if necessary at All County Healthcare, we can actually send...
Take over.
Yeah, we can take over. We can send
At home.
an occupational therapist. We can send a physical therapist. We can help them to just kind of be the bridge to the next step.
You know what's coming up now? I think we're going to see this maybe towards the end of the year, is hospital at home.
Oh, wow. Explain that a little bit.
I just got the email today
Oh,
that there is a lecture, I think it's in May somewhere. It's the new concept where we can take care of patients at home. And that takes a lot, though. We need someone at home, first of all.
A good community of people.
Yes, and we have a lot of assisted living facilities, independent living facilities.
Right.
And a lot of these places have their nurses around the clock. But if we can just do simple things like IV antibiotics, IV fluids in their home,
Yeah.
wouldn't that be great?
Yes.
And also physical therapy at home, that would be great.
You know, I think it's great for everyone because the patient wants to be at home in
Exactly,
the comfort of their own
exactly.
home, you know, around their family, and so it really works well for everyone. So
Right.
that's going to be the trend, you know.
I
Like
think so.
Like
I
said,
think
all
so.
county healthcare, we'll be able to send the patients exactly, you know, what they're going to need.
And then home health care to
Sure.
keep patients, people just in good health so that they don't end up in the hospital for something that could have been prevented.
Yes. Absolutely.
Like urinary tract infection, we get common. This
I
is,
heard that's very common
it
in
is-
seniors.
well, there's a lot of reasons for that.
Interesting.
They have debility.
Okay.
They're unable to walk to the toilet
I see.
or perform
Yeah.
what they need to do to clean themselves. So they're at risk of
Yeah.
getting an infection and also dehydration.
Right.
Those are, yeah.
Common factors. So let's for those people tuning in right now and they don't know about your background. Let's dive a little quickly into your background. Where did you go to school? And
Oh, okay.
yeah, because some people, you know.
Oh, I
know
see.
that.
Okay.
So tell us a little bit about your background.
Well, we came to this country when I was 11 years old with mom and dad. They're both physicians. My father was a surgeon and my mom is a pulmonologist. So I finished my university at Buffalo, New York.
Nice.
I have a chemistry, then I went back for pharmacy degree, then I went back for a medical school, and I finally finished my internship residency in Edison, New Jersey.
Okay. Okay. Edison, that's a good.
Edison, New Jersey.
Good
It's with Robert Wood Johnson School of Medicine. And then I moved back to Florida. I love living in Florida because of the weather.
So
It's
do I.
wonderful. Actually, I came here as a pharmacist right across from Century Village in Deerfield Beach.
Oh, so you were busy across from
A
Century.
Century Village,
You had a lot of
yes.
prescriptions to
So
fill.
actually, they're the ones that sent me to medical school. I said, I can't deal with this. I think we need more physicians in the community. So that, one of the reasons I went back to school.
Right.
And then I ended up in Boca Raton. I had my office at Meisner Park. And one night I had this one patient come in late afternoon with a aide from an assisted living facility.
Oh, okay.
And I didn't like the way he looked. It was Christmas Eve. So I sent him to the hospital.
Okay.
And the ER constantly calling me saying, come and pick up this patient. We don't know where he lives. He has dementia.
Oh.
I said, I don't know. I mean, there's some place is called blah, blah, blah in Boca Raton. So after the third call, I said, darn it all, I'm closing the shop, the office. I went to North Broward Medical Hospital, North
Right.
Broward, and I picked up the patient, brought him home to the assisted living facility.
Wow.
And I said, and he was so grateful.
Oh.
And I said, I could see these patients where they are instead of having them come to the office
Right.
because it takes a lot of effort
Yeah.
for them to come to an office setting
Yeah.
with their aides, and some of them are demented. They skip lunch, they skip their water,
Right.
etc. So I said that's how I started practicing at the nursing home facilities and the rehab facilities. I saw that there was a great need for that. Most of the doctors had their own offices. I had my own office, a huge overhead, and I said, let me just go and see these patients where they are, provide the health care. So over the years, I think a lot of the nursing homes have improved
That's good to know.
their what they can offer to a real sick patient with so many complications. So we're getting there. I mean, hospitals are so overcrowded right now.
Well, and especially I think South Florida, there's a big demographic of seniors, and then more and more coming each year. So it's really been a population boom here, and so I imagine it's hard to keep up with the demand with
It is,
all
yes.
their needs that they have.
That's where we take care of them at Legacy, at these facilities, Stratford Court, Edgewater Estates. They're great facilities.
That's good to know.
And some of them provide a really critical care to these patients. It's almost like the hospital.
Nice. You
Yeah.
look very refreshed, Dr. Attar. I want to just comment on that. I don't know, like did you just come back from?
Well, I took a
stint,
little break.
Good for you.
Actually, it was a continuing medical education
Good for you.
at
You did
sea. So I did
CMEs
both.
at sea.
Yes, I got
Nice.
my CME, and I also had a little bit of
I like that.
rest as
Good
well.
for you. So
Yeah.
you get to do your continuing ed, and then you get to mix that with your
Oh, we have to.
vacation,
Yeah.
with your rest.
Yes.
Well, you look
yes.
rested.
Thank you. Thank you.
Good.
So, one thing I noticed in the cruises was I went with the celebrity cruises. It's called Apex.
Sure.
I mean, Royal Caribbean, they all have the same thing. They have the wash basins right before you enter the big dining room.
Oh, okay.
So they encourage people to wash their hands, which is wonderful.
Sure.
It's but I still think that we need to educate the public about healthy traveling, keeping healthy when you're on an airplane or in these cruises, because hand washing is not enough.
What would you suggest? What
well-
are some of your suggestions or ideas?
Of course, before you eat, it's good to wash your hands. But if you can't wash your hands, like if you're in an airplane, and I travel quite a bit between CMEs in Hawaii or going back to Turkey for a few weeks for rest. I take sometimes wipes with me, especially on the plane.
Good. Good idea.
Yeah, I have a little bag. Put my little iPhone, my wipes. Especially if you're going on a 12-hour trip with a plane.
Yeah.
And I usually wear a hoodie, sweatshirt, because I don't know if anyone behind me is going to start to cough, sneeze. People get sick. I mean,
Sure,
you can't help
sure.
it, right? So I usually pull my little hoodie up, cover my eyes, and helps me to go to sleep as well. But it's good to take a little wipes to wipe down the areas that you're going to be touching. Sometimes the TV screens on the
yeah.
back of the
For
seats.
sure.
Yeah,
For sure.
yeah.
And so I know, like, when I travel or if my kids travel, I'm like, take your zinc, your vitamin C,
Oh, yeah.
and what do you? Is there anything that we could take as far as prevention?
And there's something called airborne, which is a lot of people take.
Like vitamin C.
Vitamin C, yes, but I always, I'm more advocate for prevention.
Yeah, for sure.
Hand washing, and before you get on the plane, use the facilities before you get on.
Yes.
And like I said, try to wipe whatever you're going to be touching on that plane.
No, it makes sense.
You know what I mean?
Yeah. of
And
course.
if you have to use the bathroom on the plane, that's a tough job. Again, the wipes might also help with that.
Good. Good to know. Yeah. And what about people who are taking care of their parents? What do you suggest for them? There's a lot of people that are tuning in right now, and they're, maybe taking care of their parents. I know there's a lot of burnout when it comes to caregiving.
That's true. When they're taking care of the elderly family member at home, they need to be very careful that they're not sick themselves, so they're able to take care of that person.
Right.
Usually, we'll get a patient from the hospital who's had a family member, was sick with COVID, and they ended up with COVID. deathly ill in the hospital. So if the family or the caregivers at home are not well, stay away from the elderly.
Absolutely.
Yeah, and then make sure that their COVID vaccinations are up to date. The flu vaccine is up to date, pneumovax. When they come to our facility, we make sure that everything is up to date.
Right.
At Legacy, anyway.
Sure.
Yeah,
Because
yeah.
now they're going to be interacting with a lot of different people, so you want to make sure that everybody's
Safe,
safe and up to date.
prevented. Yeah. If someone at home is coughing and hacking, and I mean today you have to think of the flu, the rhinovirus, respiratory syncytial virus, COVID, big one. So you have to make sure that that person is not exposed to that environment, and have them check for COVID.
Absolutely.
Nowadays, I think they can check for the flu as well in the pharmacies.
Oh, okay.
I'm pretty sure we do have that
Sure.
at the facility. Within 15 minutes, we get the results.
Now, can some people, like with COVID, they're a carrier, but they're not necessarily displaying symptoms? Like I remember with
exactly,
COVID, some
yeah,
people were testing
yeah.
positive, but they're like, no, I feel fine.
No symptoms. That happens.
It's interesting.
That
huh?
happens.
Wow. Amazing how some people can test positive, not even realize that they're, you know.
It's COVID positive. I mean, some days I feel blah, and I'll come home. I said, "Oh my God, do I have COVID?" And I'll test, once, twice. I said, "No, it's negative." But
Sure.
I mean, sometimes you feel you're symptomatic, but COVID negative.
Right.
You have to be careful.
Yeah, I'm sure.
When you get home, wash your hands.
Yes.
When you're shopping, wipe that cart
yes.
with that alcohol
Yeah.
cloth that they provide you when you're going in.
Absolutely.
Uh-huh.
Absolutely. So let's talk about, I guess, I know you wanted to maybe talk about what's in the future for your vision and what you want to do for the future at Legacy, or what your plans you may have.
I like the Legacy where I'm working right now. I have 2 wonderful nurse practitioners.
Oh, nice.
And we have an excellent staff at Legacy. There's always a room for improvement. I think we're doing a good job there. But for me, I would like to work as long as I could. Not
Nice.
because I have to, but I think there is a need. And I would like to see if we can keep patients at home with home visits, especially if the patient is debilitated, bedbound. And those are the patients that need to be seen, because it's very difficult for families to bring a stretcher to the doctor's office. It's like the old-fashioned doctor with that black bag going in.
Yeah.
I'd like to see if we could, it's just preventing disease so they do not end up in the hospital.
So, talking about preventing disease, I know a lot of challenges are lifestyle related from what I'm hearing, talking to different doctors. You know, a lot of maybe, I don't know, certain types of diabetes or certain types of, heart issues and challenges. What would you suggest, to integrate into to create a healthy lifestyle? What would be something that...
That's so broad, but mainly keeping yourself active mentally and physically. You don't have to go to the gym and work out for 2 hours and sweat.
Right.
But you can go for a walk, 20 minutes, an hour each day. That helps. If you have a pool, go swimming for an hour. Outdoors is good. And also there is your diet.
We're going to have a quick commercial break. When
Okay.
we come back, we're going to continue the preventative lifestyle. Thank you, everybody. We'll be right back.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thanks for tuning back in to You and Your Doctor, sponsored by All County Healthcare. We are continuing the conversation with Dr. Bilga Attar, who is right here at the Legacy at Boca Raton, 6363 Verde Trail South, Boca Raton, Florida, 33433. She can be reached there at 561-483-9282. And I really want to throw in that the Legacy has been rated by U.S. News best short-term care facility in the U.S., so that's very impressive. So
We're very proud of that. Yes.
that's very impressive. So, Dr. Attar, let's finish what we were discussing about, I guess, preventative, what we can do at home for our health, and you were talking
Well,
about.
I mean, there are things to be expected as we get older. Our hearts get older.
Sure.
Our blood vessels get thinner. But I think the best thing we can do is to, again, be physically and mentally, be very active. Walking, swimming, and things like we get pleasure out of.
Yes.
Not necessarily, as I said before, working in the gym for 3 hours.
Right.
It's not,
Yeah.
And then healthy eating is good. Since I'm from the Mediterranean area, I love, when I go back to Turkey, I love to go around the farms and see all the olive trees.
Nice.
And the grape vineyards, just like California, actually. Very nice.
Such healthy food in the Mediterranean.
Yes.
Yeah.
We have a lot of fish dinners.
Nice, delicious.
From the Black Sea and from the Aegean. And then greens, a lot of leafy vegetables, lettuce, different types of lettuce. You can have iceberg, romaine, red lettuce, green lettuce. Tomatoes are excellent. Lots of lemon. I mean, when I buy lemon, I buy it in a big bag.
Oh, nice.
And I keep it in a refrigerator. Lemon on everything. That's good vitamin C.
Absolutely.
Stay away from the fast foods. I mean, I think everyone knows that.
Yes. Yes.
Legumes such as lentils, beans are excellent. They're anti-inflammatory. Also, turmeric is very good for anti-inflammatory for joint pain.
Nice.
And watching your calorie input, not to overeat.
I know sugar's a big thing.
Oh, I
Trying to
know.
control the sugar is sometimes a
know.
little challenging.
Everything we buy today,
Yeah.
it seems like I read the label, there's sugar in everything.
Yeah. And it disguises itself in different names. It
Yes.
doesn't always say sugar. It'll have whatever, HCP, which is the
Well,
high fructose, or HFP, high fructose corn syrup, whatever.
you can look at the breads, for example. If they have minimal sugar, they'll tell you how much sugar is in
Yes.
that bread.
Yeah.
and I haven't seen one bread. Maybe the deli breads are not, there's no sugar, but try not to eat any processed foods.
Absolutely. Stay
And
fresh.
organic if possible.
Mm-hmm. Mm-hmm.
I think the big organic foods that I would go for would be the strawberries. I think organic strawberries are better than the regular
Yes,
strawberries.
for sure.
If you can afford it. Otherwise, just wash it really well.
Yes.
You know,
I know they say that about strawberries because those are the most porous fruits, so they get
more
more
of
pesticides.
the yes,
Yes, so
yes.
definitely organic, taking that route.
Blueberries, oranges,
Mm-hmm.
tangerines. Keep it in the refrigerator at all times. Snack on the little tangerines if you want the snack.
Yes.
Crackers, I would do. Limit the crackers. Limit anything that's in the box.
That's right.
Chips.
Yeah. Yeah.
I mean, it's very easy to gain weight. I always struggle with weight myself, but I try not to eat
Sure.
the fast foods anyway. That's something I don't do.
Yeah.
Yeah.
Yeah. So we have a quick question from the audience. If we can chime in.
Dr. Attar, you had mentioned earlier about the hospital at home idea. Can you please expand for our listening and viewing audience a little bit more about that in detail? Thank you.
I think this is something that's coming up in the future, probably the near future. There are, as we get older, or even some patients are debilitated, they're at home for different reasons. But there are a lot of, as we get older, we acquire chronic conditions such as high blood pressure, diabetes, chronic kidney disease, and then there's cancer. That's a whole big thing.
Right.
So if we can send lab technicians to their home, which I think we are doing now with COVID. This started since COVID. We can send X-ray technicians out to the homes, and the physician actually could visit, or the nurse practitioner. Telemedicine is wonderful, but I still like to do it in person to listen to their lungs and heart. You can't do it very well just doing telemedicine.
We have about 1 minute left to wrap up.
Okay.
Dr. Attar, sorry to cut it short, but the time has flown by. If you want to just wrap it up with any last thoughts.
Well, I hope this comes to being that patients can be taken care of at home.
Agreed.
We all
Yes.
are looking to that.
Thank you so much. Thank you so much for joining us today on the show, Dr. Attar. We appreciate it. Have a
Thank
great,
you.
great evening, everyone.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2T